Hello everyone. Today the topic which we guys gonna study is atrial flutter. So what is atrial flutter? The atrial flutter is a supraventricular tachyarrhythmia. What is meant by the supraventricular tachyarrhythmia? Mean that it is an arrhythmia which arises above the ventricle. Mean in atrium, and it is a tachyarrhythmia. Mean that it will produce heart rate above 100 beat per minute. So what happened in atrial flutter? In atrial flutter there is a formation of macro reentrant circuit which rotate around the annulus of a tricuspid valve. This macro reentrant circuit will produce a tachyarrhythmia. It will produce a heart rate about 300 beat per minute. And remember that this macro reentrant circuit which rotate around the annulus of a tricuspid valve is about the same size as the atrium. So it will produce a constant rate about 300 beat per minute. So the atria will beat at a rate of about 300 beat per minute. So what will be the ventricular rate? The ventricular rate will depend on the AV nodal block. In atrial flutter there is a nodal block which will determine the rate of a ventricle. If there is a 2-1 AV nodal block, the ventricular rate will be 150. If there is a 3-1 AV nodal block, the heart rate will be 100. And if there is a 4-1 AV nodal block, the ventricular rate will be 75 beat per minute. So the ventricular rate will depend on AV nodal block. So in a nutshell, there will be a fast atrial rate, then there will be a AV nodal block which will determine the ventricular rate. Sometimes there will be no AV nodal block. All the fast arterial contraction will passes toward the ventricle. In this case, the patient can suffer hemodynamic compromise and there will be an patient may transform into a ventricular fibrillation and it can die. Apart from that, when a patient have atrial flutter with AV nodal block and the variable ventricular contraction, the patient can feel palpitation, syncope, breathlessness and fatigue. On ECG in atrial flutter, there will be an absent P wave and the narrow QRS complex. The absent P wave is replaced by a flutter wave. In lead 2, 3 and AVF, there will be an inverted flutter wave which will resemble a sawtooth pattern, while in V1 there will be an inverted flutter wave which will resemble a normal P wave, but it is not a normal P wave, it is a flutter wave. As you guys can see in this ECG, in lead 2 that there are two flutter waves, then there is a QRS complex. After that there will be a two flutter wave and then QRS complex. This shows that there are about 2:1 AV nodal block, mean that there are two atrial contraction for one ventricular contraction. And if you look at the rate, the distance between the two P wave is about one large square, which is equal to 300 beat per minute, and the distance between two consecutive R wave is two large boxes, which is equal to 150 beat per minute. So the atrial to ventricular rate is 2:1. Apart from this 2:1 mean that the two flutter wave for one QRS complex, there can be 3 flutter wave, 4 flutter. It simply depend on AV nodal block. Remember that in some ECG tracing, when you look at it, there will be that irregular rhythm. People will confuse it with an atrial fibrillation, but it is not an atrial fibrillation. It is simply a variable AV nodal block. Sometimes there will be a 2-1 AV block, sometimes there will be 3-1 and so on. So there will be a variable AV nodal block. So there will be a variable rhythm which people confuse it with atrial fibrillation, but it is not atrial fibrillation. You guys can see that in this ECG that it show an irregular rhythm, but it is not atrial fibrillation. It is just a variable AV nodal block. So it was all about the pathogenesis, that what cause atrial flutter and what will be the ECG tracing of atrial flutter. Now let's study about the causes. Remember that the atrial flutter is a male predominant disease. Its frequency occur more in male as compared to female. It increases with age, alcohol and diabetic mellitus, and it is most commonly occur in a patient who is suffering from chronic obstructive pulmonary disease and heart failure. The heart failure is the most common association with atrial flutter. To identify the cause, we perform echocardiography. Echocardiography is the best initial test to perform to identify the cause of atrial flutter. After this, I will discuss the treatment, but the treatment is discussed in detail in atrial fibrillation video because the atrial flutter and the atrial fibrillation have same treatment. But I will just give you an outline of a treatment. To treat the atrial flutter, we control rhythm with beta blocker, digoxin or calcium channel blocker, or we control the rhythm with the help of pharmacological cardioversion or electrical cardioversion. And after controlling rate or rhythm, we give a patient a thromboprophylaxis which will prevent the stroke, and we prescribe the thromboprophylaxis on a basis of a Chad-Vaz score system. Apart from that, we can also perform radio frequency ablation in which we cauterize the myocytes, so it will break this reentrant circuit which is a cause of a atrial flutter. So it was all about the atrial flutter. If there is any question, you guys can ask, and the treatment, I will discuss the treatment in detail with atrial fibrillation.